Clinically, I provided services in the transplant surgery department at the Medical College of Wisconsin, as well as the plastic and reconstructive surgery department at the Medical College of Wisconsin. So a lot of that stuff revolved around psych evals, in addition to adherence to medical care, a wide variety of medical care, post-transplant medical regimen adherence and things like that. Certainly on the pre-side of transplant, needing to abstain from drug and alcohol use in regards to needing to get put on a transplant list and stuff. So integrated motivational interviewing into a lot of the communication and conversations that I had with a lot of those patients in both of those divisions at the Medical College of Wisconsin. At Rogers Memorial Hospital, kind of had a little bit of a shift where we did straightforward, frustrating for you. So having some of that accurate empathy, recognizing the absolute worth, and this kind of comes down, this is part of that humanistic movement in psychology, a lot where, we see a lot of Carl Rogers in this area of acceptance, kind of recognizing the unique individualistic value of every person, recognizing that, people inherently, as Abraham Maslow talked about in humanistic psychology and his theory of personality, that everybody's striving for actualization and to do the best that they possibly can. Their behaviors may not match that, but having that value of the worth of every person that you're working in front of you, even if they're engaging in some problematic behaviors. Affirmation and finding the strengths, helping the client find the strengths, and commenting on those strengths, and really diabetes might improve a little bit, but I don't know if it's really worth giving up my daily Snickers, because that's an important part of my daily life, right? So in that sense, making some of those behavioral changes to improve his diabetes or manage his diabetes was not that important to him to make that change, right? So that's importance. How important is it for that person to make that change? Is it worth it for them to try making that change in their behavior? And then the other component of that is confidence. And again, circling back to Bandura and self-efficacy theory, and the question we have here is, do I think I can do it, right? And I've had extensive experience working with folks with substance use, and I remember one person in particular that I was doing an assessment with, and moving you in that direction to improving your depression, right? That's one angle to become descriptive or prescriptive and being directive in the planning. Or what we need to do is we need to refer you to a physician, preferably a psychiatrist, and that person is going to evaluate you and see about getting you put on some medication to help with your depression. So, this client comes in, maybe even sounds like they're ready to start making some change, maybe expressing some intention to change, and not recognizing that ambivalence, right? And just kind of prescribing what should be done, right? Because we're given the green light, so to speak, to go ahead. But not kind of, again, from an MI perspective, recognizing that ambivalence that might be there, even though it's the person saying, yeah, I'm ready, I intend to do some things about my depression. So then we put together this plan of action, right? And